Welcome, everyone. Today, I'll be delving into the often overlooked challenges faced by physicians and other healthcare provider parents in rural medicine. This issue isn't just about healthcare, it's about the well-being of our communities and the professionals who serve them. Issues that affect how we attract, keep, and support doctors and other healthcare providers. But before I start, I'd like to acknowledge that I am joining this presentation from the traditional, ancestral, and unceded shared territories of the Kwantlen, Matsqui, and Kutsi First Nations. It's home also to the Surrey Delta Métis Association, and it's in Langley. It's known as Langley, BC. So I'm excited to introduce the working group that did this project. It's called the Parenting in Practice Working Group. It's an initiative led by Dr. Charka Mahaswaran, and it's under the RCCBC. Our goal is not just to support physician parents, but to fundamentally integrate parenting and all the ways it affects our rural healthcare providers into the fabric of medical practice, normalizing the issues faced by these parents, especially in rural areas. So our main objective in this project was to hear directly from rural physicians and other healthcare workers, actually, who are parents or planning to become parents. We sought to understand their unique needs and the gaps and barriers they face in juggling and balancing their dual roles as healthcare providers and parents. To gain these insights, we employed a survey methodology that combined elements of both a community needs assessment and an ecological survey. And we wanted it to offer us a comprehensive view of the challenges at hand. So we used a combination of social media platforms, including our own Parenting in Practice group and on Facebook and other physician Facebook groups. We also added it to the RCCBC newsletter and emailed it out to many physicians, rural physicians, and got some other people around the province. Our survey reached a diverse group with a total of 58 respondents, including 52 rural physicians and some other healthcare professionals, including a couple of NPs and RNs and students. We wanted this diversity to provide us with a broad perspective on the issues at play in rural BC. The respondents were spread widely across British Columbia, as you can see, from the West Kootenay to the North Vancouver Island. This geographic diversity underscores the widespread nature of the challenges we're discussing today. It's not just in one key location. We found a standout issue from the survey. And that was the challenge of finding childcare in rural BC for these physicians and healthcare workers. A significant number of respondents faced or anticipated facing difficulties in finding suitable childcare, which is a fundamental concern impacting their professional and personal lives, and whether they stay in communities and how long they stay there. There were a spectrum of challenges. The challenges don't stop at childcare, but respondents also highlighted issues like distance from family and cultural supports, educational limitations for their children, spouse employment challenges, and more, painting a picture of the multifaceted difficulties rural physicians face as parents. So this just gives you a bit more about the issues, and it really shows you how the lack of suitable and lack of just any childcare was really front and center in this that came up in this survey, the respondents. But there's other things, as we discussed earlier. Oops. So, some personal insight to put this into perspective. Let me share a quote from a few of the physician parents who responded to our surveys. So, not having our families here combined with lack of childcare, that matches our schedules as healthcare workers is challenging. When our kids get sick, one of us has to somehow cover an ER shift or cancel a day in clinic in order to care for them, since we don't have family around to help with this. Demands of the job mean I spend less time with my family than I would like. And my partner is a stay-at-home parent, which means things are looked after at home, but I often feel like I don't get to be part of family activities as much as I would like because there are not enough physicians in my community. So I think those personal accounts vividly illustrate the balancing act these professionals perform daily. They also illustrate just how much issues relating to parenting and practice affects how these providers practice, their capacity as physicians and healthcare providers, where they choose to practice, and how long they choose to stay at various rural communities. So in conclusion, while these issues pose significant challenges for rural physicians, they also present us with an opportunity to learn and improve. It's clear there's a need for more in-depth research and proactive initiatives to support these vital members of our healthcare team. More research may open up opportunities to try new things and better support recruitment and retention in rural BC. And that's it. I would love to hear any questions or points of discussion or interest in your ideas for where this could go. As researchers, I'd love to hear your ideas.
Thank you very much, Erin. This is such an important topic, and I'm certainly sure one that could do with a lot more kind of understanding and data behind it. I certainly really agree with you that in terms of recruitment and retention, that the kind of ecosystem of each community in terms of sports and spousal employment and childcare and all these things is so important in retention. If anyone has any questions, please put them in the chat box and we'll be able to read them
out. Well, I don't see anything in the chat box. I might just mention that, ideas for further research. This was just an initial survey and it showed such a dramatic concern around this issue that we've had discussions in and amongst our parenting and practice working group about opportunities to try pilot projects, for example, could be started. Things that have come up when our ideas are the potential for, similar to universities, they have childcare facilities sometimes that are high quality attached to universities. We've thought about, could this be a type of model that could be trialed in various communities? And so if anybody in this presentation listening would be interested in further exploring these issues, here's my contact information. I would love to hear from you. And I do have some space and time to potentially partner with somebody to do some more research on this.
So there's an invite for you all to help Erin take the next steps in what I think is a really, really important area for rural practice. Does anybody have any comments at all they want to put in the chat box? Also, Tracy, if people want to follow up with questions, is the best way just to go directly to Erin? Is that the best way to work the session?
Certainly. So you can correspond directly with Erin either through the chat or following the BC Rural Health Research Exchange. If you aren't quick enough to write down your information, that's just fine. You're welcome to email me directly. My name is all over everything you've received about the event, and I will be sending follow-up information. And I can put you in direct contact with Dr. Erin Carlson as well.
I see, Olivia, you have a question?
Yeah, thank you. I'd love to go back. I think you had when you're talking about some of your participants, one of the quotes I think you kind of brushed over, or maybe I missed it, was something to the effect of I would be practicing if the
Yes.
environment was more ideal. I'd love to know, is that something that a theme that came through, or a thought for future research as well? Just wondering.
It's a thought that for future research, it wasn't a significant theme that we pulled out, but we do kind of, of course, you kind of wonder, could this kind of information be used to better recruit people? Because we know that so many and most of the graduates from medical school are in child rearing age. So this is a huge, doesn't matter if you're female or male, this is a huge issue. It looks like Bob Woolard wants to ask a question.
Bring him on screen, please.
Sorry, but I didn't want to cut that short, Olivia, but I think that, yeah, as we wait for Bob, I also wanted to mention that, I really think, oh, here, Bob's unmuted. Go ahead, Bob.
Oh, you're so very kind. I'm sorry to cut in. I was a rural doc for 2 decades and 16 years in Clearwater. And my wife, who has much more insight than I do, opined that we would not have stayed as long as we had if I didn't have such rich connections with the BCMA at the time, with the Canadian Medical Association, with colleagues outside of the community. And I just wonder what you're thinking and looking at in modern communication, where you don't have to, get guilty about your carbon footprint by being connected with colleagues around the country and around the province, but rather nurturing that kind of connection, both for the spouse and for the physician. Do you think there's a realm in that kind of connectivity that would be worth looking at?
It's a great question. And luckily, you're right, we do have some outreach with our Facebook group, and we're working on developing our next steps for creating virtual communities of parents in rural medicine to support as part of the support. And we've done some other initiatives too, but that is one of them for sure. Yeah. And
fantastic, and thanks for doing it in a thoughtful way. Not just meaning to do well, but assessing whether or not you're doing well. I just really congratulate you.
Thank you. We know that parenting does, for those who choose to and can and want to become parents, the learnings from becoming a parent can contribute a lot to our relationships with our patients and how we engage as healthcare providers too. So yeah, thank you, Bob.
Great. Thank you very much, Erin. We need to move on to our next presentation. It's been a very, very nice start for this session.